what can cold exposure do to men?
One of the earliest clinical signs of metabolic disorder in men is erectile dysfunction. And I'm going to explain why. But before I explain why, we're going to talk about how serious this is, because testosterone levels are going down, and not by a little bit. The typical 20-something has half the testosterone that a typical 20-something would have had 20 years ago. It's complicated to say. That is, young men today have testosterone levels that would be typical of older men in the past. And that's how fast testosterone is declining. And you say, well, that's testosterone. Sperm counts going down, sperm motility going down. The fertility of all these male measures are going down. But the one that hits men hardest that is going up is the rate of erectile dysfunction. And it is because of metabolic disorder. It used to be that doctors thought you didn't really need mitochondria to get an erection. The blood vessels are controlled by smooth muscle tissue. These smooth muscles, they wrap around the blood vessel, and when the smooth muscles contract, that's vasoconstriction. It shuts the blood off. And when they relax, that's vasodilation. It allows the blood to flow. Those smooth muscle tissues are signaled by what are called endothelial cells that line the blood vessels. The endothelial cells, they don't have a lot of mitochondria. And so most medical doctors are like, well, if they don't have a lot of mitochondria, they must function without making ATP. They must function through other metabolic mechanisms, and that turned out to be false. There's been a couple or three papers that show it is the mitochondria that power the endothelial cells to produce nitric oxide that signals these smooth muscle tissues. So you need mitochondria in the endothelial cells to do vasoconstriction and vasodilation. An erection requires a little bit of both. Vasodilation that opens up the blood vessels, allows the blood pressure the heart is generating to flood the penis and create the erection. But vasoconstriction on the other side to keep the blood where it needs to be. When the endothelial cells have damaged mitochondria, they are incapable of producing enough energy to signal the smooth muscle tissues to do the job that is required of them. This is why erectile dysfunction is one of the earliest clinical signs of metabolic disorder. It is a mitochondrial dysfunction that is leading to erectile dysfunction. Now, there can also be psychological issues for certain, but we're talking about we're talking about a man's incapacity to get the erections that are not associated with, it could be stress or fear or other psychological issues. That's on the rise. So how does Viagra work? Viagra overcomes insulin resistance. It forces more work out of the mitochondria. It pushes the glucose in there so that they can produce the nitric oxide, and boom, now you get the erection. And Viagra works for women too. Women have erectile tissues. It's just not as obvious, and it's not as essential for this reproductive act. Viagra overcoming the insulin resistance means it has other therapeutic uses besides treating erectile dysfunction. It can be used, for example, to promote brain healing in newborns who've experienced brain injury. But what it doesn't do is fix your mitochondria. It overcomes the insulin resistance that is protecting the mitochondria from further damage. It works not in promotion of the mitochondria, but perhaps at the expense. Ben Greenfield says, a cold plunge is like Viagra for your body. It improves your insulin sensitivity. It improves your metabolism. It stimulates mitobiogenesis. And that improves the male sexual function. Now, I get a lot of kidding about this because, on Seinfeld, they have an episode called Shrinkage. Cold water, it causes the testicles to shrink up into the body where they can stay warm. It causes the penis to shrink. And so there's, lots of funny jokes and some good internet videos. And I get a lot of direct messages from men in private because men don't talk anywhere near enough about this. And they'll say, Professor Seager, I'm 60 years old, but I'm waking up in the middle of the night with an erection. Is that normal? And I go, it is if you're doing ice baths. They'll say, I haven't had morning wood like this since I was in my 20s. Is this normal? And I'll say, how long have you been doing ice baths? And then every once in a while, it'll be like, my wife is really angry at you. Why? Well, because I read all your articles and now she's tired. I have promised AJ that I will not do anything that further increases my testosterone because she says sometimes I can't keep up. And that's all normal. Like, it's all healthy, good for me, good for these men. It's good for fertility. I'm not going to have kids with it. I can't wait to be a granddad, but I'm not at that stage where I'm not in a relationship where we're going to, we've got 7 kids between us. It's more than enough. But the men who are grappling with ED don't want to talk about it because men don't talk about health issues. And so they're going to do it in private. Or the studies that you said, there aren't enough studies. They're all coming out of Denmark because Denmark has such liberal policies for sperm donation. Turns out that you can get sperm samples from Denmark and you have good information on age and things like this. And so you can run some studies. But we can't assume that what happens to young men in Denmark is representative of what's happening to an older population in the United States. So we don't have anywhere near enough good data on what's going on with men and how to fix it. I have my own N=1 experience. I have the text messages from other men, and I have the science, the metabolism of an erection and of sperm production and testosterone that are all pointing us in the direction of have an ice bath. Keep up a regular practice of cold exposure. Activate your brown fat to keep your metabolism healthy. And your fertility is going to thank you for this practice.